They make up 7% of Australia's medical workforce, but say they're driven to despair by discrimination and red tape. Today, a parliamentary inquiry into the registration process for overseas trained doctors being held in Brisbane heard from several medicos who say the current system is forcing some to consider suicide.
These doctors all share the same frustration, navigating what they say is the difficult, complex and ever-changing system of Australian medical registration.
It is far from being transparent, and it is far from being fair, and it is a constant source of anxiety and stress.
Most of them have worked for years in Australian hospitals, but say they're subjected to more examinations and much higher standards than local graduates.
There are people on the verge of suicide. There are people who are on the verge of losing their sanity.
Dr Joshi represents doctors who've trained overseas. A quarter of all Australian registered practitioners receive their training elsewhere. The most notable, Jayant Patel, who is in jail for killing 3 patients at Bundaberg Hospital. Dr Joshi says the post-Patel era has resulted in paranoia, with the bodies which govern registration using complex examinations instead of focusing on doctors' skills and safety records.
Instead of becoming centres of quality education, they're becoming bastions of power and absolutely like clubs, an exclusive club.
Queensland Health has told the hearing its system of managing and supervising overseas trained doctors is now first class. It shares the concerns of the doctors.
A single point that manages everything for the doctor and for the employer would be ideal.
The bodies that govern the accreditation of doctors have made submissions to the inquiry conceding that the system can be complex, but that considerable progress has been made. The inquiry will hold further public hearings in southern states before reporting to federal parliament later this year. Donna Field, ABC News, Brisbane.